Good morning. Our competency for this month will be postpartum hemorrhage. This is due to our increasing number of cases where we're having post-op complications following vaginal deliveries and also cesarean sections. So we will need to increase our awareness and knowledge of recognizing and treating this potentially life-threatening emergency. Postpartum hemorrhage is the leading cause of maternal morbidity and mortality all across the world. So we are here to try to decrease those numbers and to keep our patients safe if they do experience a postpartum hemorrhage. You have your assignment sheets in hand. You've been assigned to groups of 4, so you can read your goals and objectives and keep these in mind as you go through the simulation lab. You can be asked questions at any time in this lesson about anything to do with postpartum hemorrhage and the information that you've been given. You will also have to do some research on your own to make sure that you understand all the terms, the medications as we go through the lesson. So one of the first things you will have to do is define PPH, or postpartum hemorrhage. What is it? Because that question can be asked during your simulation. So you want to make sure that you're aware of what constitutes postpartum hemorrhage. And you will also be asked to give what you think is the probable cause of the PPH, and that'll be based on the patient's history and physical that you will also perform in the simulation lab. You will have everything there that you need. You will have mannequins. You will have all your supplies and everything you need to simulate a postpartum hemorrhage, what you would do and how you would treat it. So you must know the risk factors when you complete your OB assessment. You will need to know, based on your assessment and history, why your patient is at risk and what is going on. You will need to list all the risks that that patient has for PPH. Now comes your maternal assessment. The potential symptoms can be used to determine the severity of the hemorrhage as well as the cause. So you want to make sure you are aware of why the patient experiences each of these symptoms as they are experiencing this postpartum hemorrhage. You have a visual aid here that will help you determine the estimated blood loss. This is going to be very important as you decide how you're going to treat this patient based on the severity of the post-op bleed. You must be familiar with the drugs and be able to decide on dosages and what you would give the patient. So you're going to have to know the amount that you give, how the drug is supplied. You have to know the side effects, and this is where your drug cards will come in handy. So you're expected to make a drug card for each of these medications so that you'll be familiar with them and understand their usage. Other treatment options will be available for you, including blood transfusions and also a tamponade balloon. I'll show you a picture of what that balloon looks like, but you will have to research and find out why it's used and how it's used. So here's a picture of the tamponade balloon that is also used as a manual way of stopping the postpartum hemorrhage. So be familiar with that tool and how to use it and how to set it up. And there will be one, as I said, in the simulation lab that you can do hands-on. The reason we chose the simulation model for this education is because it can decrease your anxiety, because this is an emergency situation. And I've noticed that in emergency, sometimes we get a little nervous and we're not as efficient as we should be. So the first thing you do is just take a deep breath, count to 10, and then get started, because you will know and you'll be more comfortable performing this task once you have gone through the simulation lab. Any research that you do, I would expect you to reference it in APA format and put it on your assignment sheets as you get ready to turn those in following your simulation. As I said, this is a pass or a fail. You will perform as a group. You will be in a team. Each person will have a particular role. You will have someone in the lab as a resource person but you have to tell them what to do if you need help from them. They will not help you. Um, also, you will have someone acting as a physician, but they will be busy with the patient. So you will be the one that will be getting everything ready to care for this patient. Good luck. I hope this activity is fun. It's interactive. So I think it'll be a better way for you to learn. It will stick with you. And it will use your cognitive uh, ability and also your physical ability to make sure that you know how to do it and that you understand why you're doing it. All right. Good luck, everyone.